Hi, good morning, good afternoon. How are you all doing? Welcome back to our Call for Change curriculum course. I think this will be the second part of the first session that you're all watching now. So you all know my name, but in case you missed section one, my name is Felicity, or Flick. I'm the Senior Project Manager at Common Thread, and I'm delighted to be introducing you to behavioral science as a quick overview today in this session. So what we want to do in this session, basically, is start to think about the importance of a holistic approach to health promotion. So really, that means kind of going beyond classic communications, campaigns, marketing, to thinking about how health promotion itself as an approach should and can consider social, environmental, and behavioral factors. So to make sure that your work, your approach, your tools is really based upon the needs, the values of the people that you're really working towards, but that you're using the best of behavioral science and other techniques, social change, to really think about how do you change people's behaviors. So at the end of the last session, we ended on this slide, which is basically the last session was talking all about what is health promotion. And we ended here saying that health promotion is a behavioral social science that focuses on people and how they behave. And as we know, everything that we do as a collective whole on this course in public health is really about motivating and supporting people to make good decisions for their health. And so we do have a lot of great tools, resources, approaches out of our sleeves that really helps us to use social and behavioral science. So for instance, learn about people and to be able to support people to design solutions so they can meet their needs. So in this training right now, what we're going to do basically is really quickly and a higher level introduce you to social and behavior change. What is behavioral science, especially? What is social change? How do they work together? What are some of the overall challenges that you may face? It's basically an overview, quick 10 minutes or so. And then my colleague Shireen is going to take you through a more in-depth training, which you'll receive tomorrow. So starting off then, so what is behavioral science? So for those of you that were at the Idea Lab workshop last November, you may remember this slide. But behavioral science is an evidence-based process focusing on people's knowledge, attitudes, and practices. Behavior change strategies focus on an individual as a locus of change. An individual, remember that as we go forward. So one of the really easy ways to think about behavioral science is to think like a rocket ship, as you can see on the slide here. So this rocket ship needs to launch into space. So imagine like the rocket ship, imagine it like a desired behavior. So for example, let's say our current behavior is lack of vaccination, and the desired behavior is improved vaccination. So to launch our rocket with this green arrow up into space, which is our desired behavior, we need to bypass all of the friction that holds the rocket down on the ground and increase the fuel to get our rocket up into space. So our barriers, so for instance, what we call friction here, and our fuel is what we call motivation. These are the things that we really need to understand when we're doing health promotion work. We need to understand what are the enabling factors, our fuel, or what are the friction holding things down. So for instance, when you're thinking about vaccination, what are the things that stop people from being vaccinated, the friction, and what are the things that really enable people to get vaccinated? That would be the fuel. So you must remember that if there is too much friction on the left-hand side of this rocket, or there's not enough fuel, not enough motivation, the rocket will not go into space. The desired behavior will not happen. So this is something that my colleague Shireen again is going to really touch on tomorrow. She's going to go through this in a little bit more detail. This is something which I kind of wanted to introduce you to today. So now you've understood behavioral science. Now let's try and think about social change. So social change focuses on the community as a unit of change. Sorry, I've got an alarm popping up there. We know that people do not function in a vacuum. You do not function on an island. I do not function on an island. We've all got friends, we have family, we have environments, we live in countries of different cultures, different norms. So social change really focuses on this as the community as a unit of change, as it says here on the slide. And it aims to change behaviors on a large scale to eliminate harmful social and cultural practices and to change social norms and structural inequalities. Okay. And whenever you're reading and kind of following these recordings, please always remember as well to write any questions you have in the WhatsApp group, and we'll all be happy to support. So by this point, you know, okay, behavioral science, social change. Well, the big thing to take home from today is that really these are complementary techniques, okay? They work together, they go hand in hand. Behavior change, as we said, the unit of change is focusing on individuals. Social change, the unit of change is focusing on communities and systems. But still, even when we're thinking about individuals and communities and systems, you're probably still thinking, but there's so many other parts of social and behavior change that we need to think about, and you're right. So focusing on the individual and social system, community, isn't always enough, not always. So for effective behavior change, more often than not, we also have to think about these other layers here to influence change at all levels. So the SEM, the socio-ecological model, is a really simple tool that really enables us to look at all the levers of behavior and change across the system. So this model really helps us look at, okay, what are the policy enabling environment barriers or motivators to change? What are they at the community level? What are they at the organizational level? So for instance, what are they in the health setting itself? What are they at the interpersonal level? And what are they in the individual level? And so this is something that we're going to explore in a little bit more detail tomorrow. But it's just kind of getting you thinking now that actually, when you're thinking about your health promotion strategies or your interventions, you need to be thinking about what is that friction? What is that fuel for the individual? What is it for the community? And where are there policies, enabling environments, organizations, interpersonal relationships that can also add to that friction and fuel? And what we're going to explore in this course is also then understanding, how do you research those? Because you might be hypothesizing, but really we always need to make sure we're basing this hypothesis on data. Okay. So some things to remember. So some of the most common barriers that may emerge in positive health behavior uptake. So for instance, going back to our original example of vaccination, it could be many other behaviors that we're looking at. First one we see a lot of the time, and you'll all probably be very familiar with this term, is lack of social norms. So as humans, as human beings, we tend to imitate what others do as the behavior of the majority is perceived to indicate the desired course of action. Therefore, if people see somebody they love or respect performing an action which is similar to the norm, they will often mimic what they do. So for example, if people in the community are not vaccinating their children, the chances are that other parents will also not do that. They'll follow the norm. Another big challenge we face at the organizational level, if you think back to the SEM, is a lack of access. So even if people have favorable intentions, they want to follow up on a positive health behavior or any behavior for that matter, they might actually inhibit and face challenges when they actually try to get to the service. So for instance, if the service may be too far away, it may be too expensive, there may be gender barriers. So for instance, there are no female health workers, which is inappropriate for certain cultures, etc. Another big barrier people may face is poor service. So they may get to the health service and then have a really negative experience, which makes them unlikely to go back again. So for example, they may face really nasty attitudes of health workers. They may be rude, they may be derogatory, and that would make people not really want to go back again. It would impede on their intention and motivation. It would add to the friction and reduce the fuel. And then finally, lack of positive reinforcement. We see this time and time again in our projects. So for instance, let's say you have seen a family finally get to the health center. They've been vaccinated in this example, and then they leave. but there is no positive reward. They're sat there, they've come all this way, they've paid, they've missed a day of work, they've gone to all this effort, they've now got screaming children, and there's no positive reward. In addition, they may leave and then have no idea when to come back. They have no follow-up post-vaccination. And so there's no kind of reinforcement to keep that behavior going. So these are 4 kind of common barriers that impede on positive behaviors, but there are many more. And of course, what we'll do in this course is kind of help you learn about how you can find out about what are the most important barriers, friction that you might face in your local area. Okay, but the solution, say for instance, we have to think back to those 4 barriers that we've just seen. Often the solution that kind of comes up time and time again, from all the way from local organizations to ministries to implementing partners to global partners, is communication campaigns. So let's just tell people through leaflets, through pamphlets, through banners, that they should do something. We saw this during COVID. You should go for your vaccine. Show it during Ebola. We see it in routine immunization. We see it immunization. We see it time and time again, that murals, posters, they are not enough. It doesn't work. It's insufficient. There's a lot of data and evidence that says communications on its own, on their own, without any other reinforcements, will simply not change behavior. They won't have an impact. So the assumptions of these communication campaigns is that if people have better information and they've got better knowledge, then they will change their behavior. But as you will see in the next kind of few sessions, there are many other factors that can really lead to actually people not changing their behavior. And that's really what we want to get to through this course. So you can see, for instance, this quote here on the right-hand side from the World Bank report in 2020. In the past, strategies to increase community acceptance and uptake of services have traditionally focused on information, education, and communication, IEC, you may see a lot of the time. These approaches are implicitly based on assumptions about human rationality and decision-making that are generally not supported by evidence. So something that we really want to do is show you other options that you can use in your day-to-day work, the local levels, that are supported by evidence. Okay. So what can we do? What if we could change this? What if we could, together as a group in this call for change, really think about how do we really tap into the available resources, strategies, tools, approaches that are available at our fingertips to change behavior, to go beyond communication? What if we were able to put people firmly at the center of the health system at your county level? And that is what we're going to be trying to do over the next few courses. So as I said, this is very much an introductory presentation. It's much more kind of introducing you to the topic. Next session, we're going to then start to introduce you into behavioral frameworks themselves to get a little bit more in depth about this. Okay, so as a resource, we've got this video here from Google's head of behavioral science, which is basically explaining why we do what we do. So we'll send that to you over the WhatsApp too, so you can have a little read of that and watch of that. And then tomorrow we'll be sending you your first kind of real session and learning session. All right. So up next, behavioral frameworks. Thanks, everybody. If you have any questions, please do let me know. Otherwise, speak to you soon. Take care. Thank you. Bye.